Poverty is one of the key barriers to accessing diabetes healthcare across the world. For this report, we went to Georgia to find out how the World Diabetes Foundation is working with the Georgian Red Cross Society on an ambitious project to bring about change for the country's poorest communities.
Red Cross volunteers go from door to door in rural Georgia. In communities like this, there's a hidden but prevalent disease. Lifestyle and family history may indicate who has it.
Когда собираетесь поехать туда? Вы часто употребляете фрукты, вот это?
Volunteer Anna Arutinova helps patients complete a questionnaire. These are the first steps in identifying who has type 2 diabetes. Globally, more than 460 million people live with diabetes, almost 80% in lower and middle-income countries like Georgia. With funding from the World Diabetes Foundation, Georgia's largest humanitarian organisation, the Georgian Red Cross Society, is helping to diagnose and treat one of the greatest health challenges of the 21st century.
Diabetes is a huge problem in Georgia. Looking at statistics, non-communicable diseases, including diabetes, cause the high mortality in Georgia. So this is when the Georgia Red Cross identified these issues and we got involved. World Diabetes Foundation is a very important partner for us. It's thanks to them that we're actually able to implement the project.
Today, the World Diabetes Foundation is a leading global funder of diabetes prevention and care projects in the developing world.
Partnerships are at the heart of what we do. Most of our funding goes towards capacity building, that is helping the health systems increase their capacity to treat diabetes, for example through training of health professionals and awareness raising.
Anna explains that the community here is Armenian. Being Armenian herself has helped her to build trust.
Многие должны знать про это, потому что в основном большая часть этим живут уже. И должны, я не знаю, знать про это, и мы им говорим, и рассказываем, и про диеты ихние, и про лекарства, и про лечение. У некоторых выявили, забрала я к врачу. Она послала уже тоже, подтвердился диагноз. Забрала к эндокринологу, уже там больше сделали мы там, и я их сама забирала, анализы и все такое.
The Red Cross helps patients visit this part-time doctor's surgery. The local doctor checks blood sugar levels. She has herself had training and support from the diabetes program. But in most villages there is no doctor. So Red Cross mobile teams drive out to provide screenings.
People still do not have the access to the health systems in the rural areas. So when we see the diabetes problem, we see that people do not know that they have the problem, or when they have this diabetes, they don't have the access to the health services.
I'm in the village of Samshilde. It's an Armenian village, and most of the people here only speak Armenian. But they've been able to fill in the questionnaire, which is in 3 languages, Armenian, Azeri and Georgian, and they've been invited to be screened in the centre of the village here in the bus stop to see whether they are at risk of diabetes.
The results have been dramatic. Since 2018, more than 3,000 new diabetes patients have been identified and are now getting treatment. Local healthcare professionals say the cooperation with the Red Cross has been a game changer.
მეტი სასწაული რა უნდა იყოს, როცა ადამიანი ვერ მიდის, დავანებოთ თავით უგნებავთ ამ დიაბეტს, ვერ მიდის სტაციონარში, ვერ მიდის ამბულატორიაში და აგერ სახლში აკითხავენ, მეტი სასწაული რა გნებავთ, სახლში აკითხავენ და სახლში უღებენ სრულიად უფასოდ და უკეთებენ და გამოვლენები არის.
But the care doesn't end there. The Red Cross helps patients form self-help groups. Leah tells me her friends all have diabetes.
შეცვალა იმ ხრივ, რომ ძალიან ნერვიულობდით ყველა, ძალიან. იმიტომ რომ განვიცდით, რა თქმა უნდა. ეხლა ვუზიარებთ ერთმანეთს, ველაპარაკებით ერთმანეთის პრობლემებზე. ასე, ვეხმარებით ფსიქოლოგიურადაც, თუ საჭიროა, მორალურადაც, მატერიალურადაც ძალიან ერთად შეკრული ჯგუფი ვართ.
The Red Cross is looking to expand the programme to other regions and is confident it will be able to sustain its work after the funding cycle ends in 2021. If it can, the future looks bright for beating diabetes in rural Georgia.